In this video, I want to talk about healthcare and the high cost of having healthcare. So I'm looking for your 2 cents on reinventing you. Hi, I'm Amelia, and I am going on a reinventing journey. That is, I'm transforming myself into something new. I quit my job. That is, I retired early about 4 or 5 months ago, and I am discovering that sometimes living without an income is pretty expensive. One of the things that I've discovered in my reinventing journey is the high cost of healthcare. And I want to talk about that today, but I really want to get a discussion going. So I'm looking for your comments. Please, at the end of the video or anytime during the video, leave your comments below. Let's get a good dialogue started. Okay, I have to start out the video by saying I am not an expert on healthcare. I take care of my own health and that's about it. I am learning as I go, and that's why I'm looking for your input and wanting to get a dialogue going. Let's talk about this, because here's the deal. I have had so many conversations with others, specifically women, who are pulled and called to do something else in their life, whether it is to quit their full-time job and work in a nonprofit, whether it is to quit their full-time job and do something like be a forest ranger. But you know what? They stay in their job because of the high cost of healthcare. They can't afford to leave what they're doing, the place where they're pretty much miserable, without having healthcare be an issue. And I understand that. Oh my gosh, since I retired, we've been covering my healthcare. Now, previously, my employee covered my healthcare, and my husband's employer covers his and our son's healthcare. So we were doing really well because we weren't having to do anything. Everything was taken care of by the employer. But as soon as I stopped working, my husband had to pick up the cost of my healthcare. Now, my healthcare is the same cost as it was when I was working, and it is really hurting us every single month. I don't take any major medication. Right now, I don't have any major health problems or concerns. What am I supposed to do? What are we going to do? And that's just sort of like all I'm thinking about is I need to get a job just so that I can pay that X number of dollars a month. And so I started looking around, and I got on the computer thinking I could choose another form of health care to find out the deadline. Now, this was on October 1st. So to find out the deadline for changing your health care was like September 30th or something. I never could figure that part out. So now I know I have a year to really figure this out. But in the meantime, how are we going to keep afloat trying to pay this large amount every month? So I looked up some statistics on the internet. As far as I could tell, these are pretty current. According to the Milliman Medical Index, the average cost for a family of 4 is $28,166 this year. That's 2018. Now, another source, the National Conference of State Legislatures, said that that number should actually be 19,616. So maybe you can look at your cost and figure out, are you about average? Are you more? Are you less? I know there are other opportunities out there, but I don't know about them. I mean, I don't know, what do you do? I mean, I start thinking about people who don't have any income. How do they afford healthcare? Well, I guess they go without, which is supposed to be illegal right now. And I'm not fussing at any particular government agency because I think everybody has made a mistake in this issue. I really feel like the whole issue has to do with the health insurance companies, the pharmaceutical companies, and the hospitals. Really, seriously, folks, they're the ones running this whole industry. They're the ones pushing for all of this high cost, and it's killing us. I was reading recently in a magazine where so many people go to hospitals thinking they're covered, but they come out and find out they're not covered. They still owe this X amount of dollars. For instance, when I had a colonoscopy recently, which was good, it was my time to have one, they said, oh, you're covered. With your insurance, you're fully covered for your colonoscopy. Great. What they didn't tell me was that I was not covered for the anesthesiologist. Now, I don't know many people who would want to have a colonoscopy without an anesthesiologist, but I'm not there yet, so it would not work for me. You know, all of a sudden I'm getting these bills and I'm like, wait a minute, I thought this procedure was covered. I'm sure you have a story like that where even though you think you're covered under your current insurance and you go in, you find you owe more money. It is crazy. So what do we do? If we want to follow our passion, how can we and still be covered by health care? I was talking to an acquaintance of mine recently, and she said years ago her daughter did a semester abroad, and she was in New Zealand. And in New Zealand they have social medicine. People who want to discover what they want to do, they can do anything because they don't have to worry about it. They're going to be covered in health care. Now, I don't know the quality of health care. I don't know anything about that, but that's not something holding them back. Is the high cost of having health care and health insurance holding you back from doing what you really want to be doing? I invite your comment, please, below. Let me know what you think. What has your experience been? Do you have recommendations? Are there websites that we can check out? I want to know more. I'm probably going to be talking about this more because this is a serious issue. I want to get this discussion started. I hope you have a great one and stay healthy.